Healthcare in the United States is a hotly debated subject. Concerns about the quality and cost of medical care are on the minds of many. While many people think of healthcare as taking place inside the hospital, concerns about quality, cost, and safety are valid for the emergency medical services responding to America's 911 calls. However, these emergency response systems exist both outside the hospital and outside the public consciousness. Today we're going to talk about EMS education in the United States, and particularly how insufficient education is a patient safety concern. My goal is to present a compelling argument to EMS educators, the general public, and representatives in government for both the increased breadth and increased rigor of EMS education. But first, let's define what EMS and pre-hospital medicine are. Emergency Medical Services, or EMS, is the system which responds to medical emergencies. When you call 911, an ambulance staffed with emergency medical technicians, EMTs, or paramedics drive to where you are. EMTs and paramedics will perform an assessment on you, make a working diagnosis of your conditions, and then apply treatment based on a set of medical guidelines. All this occurs while loading you into the ambulance and driving to the emergency department. This type of medical care outside of a hospital is known as pre-hospital medicine and takes place in every town and city, in every state and territory, all over the nation, every day. EMS has been given the public trust to enter our homes on our worst days, to save lives, to reduce suffering, and to prevent unnecessary disability. Pre-hospital medicine is unique in healthcare for the kinds of challenges not seen inside a hospital. Patient care could take place outside, where inclement weather such as rain or snow plays a role in how much and how well treatment is applied. Dangerous environments such as the sides of highways and scenes of violence place pre-hospital providers' lives at risk. Care takes place at all hours, including at night or in confined spaces where lighting is of poor quality or even absent. Lacking the resources of an entire hospital, ambulances contain only what is reasonably needed to treat a handful of patients with the most common illnesses or injuries before needing to be restocked. Most of the care is performed while driving down the road, with bumps and turns making sensitive procedures like placing an IV or pulling medication into a syringe difficult and sometimes dangerous. Pre-hospital medicine is a complex environment, and a lot can go wrong. In the United States, and in many other parts of the world, to practice medicine you must be a board-certified, state-licensed, and hospital-credentialed physician. Nearly all non-physician medical professionals are only able to perform their jobs because they practice under a supervising physician's license. EMS is the delegated practice of emergency medicine under the supervision of a physician medical director. However, nearly all of the medical care rendered by pre-hospital providers is done without the supervision of a physician. Treatment is determined by a series of written guidelines called protocols, which must be detailed enough to describe effective care, yet simple enough for pre-hospital providers to memorize. The complexity of the U.S. healthcare system, the sophistication of modern medical equipment, the understanding of medical conditions, and the expectations of quality have all evolved over time and continue to increase at a brisk pace. As the American population becomes less healthy, as the prevalence of disease increases, as patients present with more overlapping chronic diseases, the more Americans require nuanced medical care. Pre-hospital providers are expected to overcome their complex environment, to exercise high levels of technical skill, and produce best possible patient outcomes. This involves integrating new techniques, new types of equipment, and new knowledge into their repertoire. While most areas of healthcare in the United States have advanced their education and practice in step with the scientific progress of medicine, EMS has changed little in how it delivers care since its inception in the 1970s. Updates to the national standard curriculum come in 10-year intervals and fail to keep pace with the modern standards of care. Meanwhile, EMS providers are having well-documented difficulty with patients that present with unusual illness or injury, patients with multiple overlapping issues, or patients in complex environments. Emergency medicine requires complex care. When you combine the sorts of complex environments in which EMS operates with the kinds of complex patients accessing the 911 system, you get a situation rife with the potential for medical errors to occur. EMS providers are now placed in a position where they must use critical thinking and clinical judgment skills. However, the current national standard curriculum for EMS providers does not cover critical thinking or clinical judgment, and devotes little attention to the topics of research and patient safety. This contributes to a threatening environment for patient safety, where errors are made unknowingly and are difficult to trace, explain, correct, and ultimately prevent. This, in addition to other consequences for the healthcare system, such as emergency department overcrowding as a result of EMS being unable to determine whether a patient needs to be seen at a hospital or if there are other more appropriate resources. Many of these medical errors may be preventable with the application of keen critical thinking and a broadened basis of medical knowledge. The results may save the U.S. healthcare system tens of millions of dollars, or it may save someone's life. Today, EMS providers are the only healthcare professionals in the nation allowed to perform an assessment of a sick or injured patient, make a diagnosis based on their own assessment, and provide treatment including medical procedures and medication administration without either a master's degree or direct oversight by a physician. However, EMS providers generally receive medical training measured in hours rather than years, and very few have obtained even an associate degree related to the field of medicine. In many areas of healthcare, increased educational preparation for medical providers has been linked to better outcomes for patients, whether that's measured by less time spent in the hospital, fewer life-threatening infections, or just fewer errors made throughout the course of care. While the subject of whether a degree is required for EMS is divisive and contentious within EMS, providers also complain that they don't feel trained and prepared when faced with unusual patient care circumstances, such as bad trauma, incidents with many casualties, or large-scale infectious disease outbreaks. Being thrust into an emergency where you're expected to provide top-notch care for a problem that you don't fully understand is nerve-wracking. Compound this with the ever-present specter of medical lawsuits and the poor compensation and support most EMS providers receive, and we begin to understand some of the high rates of divorce, PTSD, and suicide within the EMS community. So what's the solution? Well, the solution is as complex as the problem. Some of the problems that we face as a community of practice are: degree requirements alone will only solve part of the problem. There are pragmatic concerns about the applicability of college courses to the reality of EMS. Many opponents cite the high cost of education and the low pay of EMS as barriers to greater education. While the benefits of a college education and its impact on quality of life are well documented, some of these concerns may be initially resolved by transitioning the EMS National Standard Curriculum to an educational objectives-based format, allowing EMS educators to focus less on a list of topics and more on the modern best practice in emergency care. Pre-hospital medicine is currently delivered predominantly by public safety organizations, mostly fire departments. Many EMS providers who also have firefighter responsibilities will go relatively long periods of time without treating a patient. This leads to a decay in skill and ultimately poor performance when emergencies occur. While many fire departments do a great job serving their communities, the goals of public safety and healthcare do not entirely overlap. By law, EMTs and paramedics are not considered qualified healthcare practitioners and are restricted from making the kinds of treatment and transport decisions that would best help their patients. While EMS providers are licensed by their respective states to provide care under a physician, no state currently considers EMS providers to be medical practitioners. This may be due in part to the lack of what many consider to be a minimum standard of education for healthcare, a college degree. So what can we do? Well, as EMS professionals and educators, we must be the example. In many other healthcare professions, a greater degree of education is a prerequisite to appointment as a clinical educator. Attainment of a degree in the sciences will provide us with a lens of theoretical knowledge through which to share our field experience with our students. With the benefit of an education, we'll be better able to advocate for modern standards of education. As members of the public, contact your representatives in all government levels. Let them know what level of care you expect when you dial 911. The manner in which emergency medicine is delivered outside the hospital in the United States does not represent the modern standard of care. As representatives in government, acknowledge that legislation is required for the kinds of change needed to correct the emergency medical services system. Establishing EMS as an essential service, increasing the minimum standard of education for EMS providers, aligning EMS with healthcare rather than public safety, and recognizing paramedics as medical practitioners are all steps in the right direction to protect the health and safety of your constituents and save tens of millions of dollars wasted on inefficient care. In summary, emergency medicine taking place outside the hospital is increasing in complexity. If EMS education doesn't keep pace with the rapid advancements in care, patients could be increasingly placed at risk for potentially preventable medical error. Thank you for your time.